I'd like to talk to you for a moment about a new mobile pain treatment program that's now available in Alabama. And I happen to love the state of Alabama, so I'm excited to tell you about this. This is a mobile program for treating peripheral neuropathy pain, uh, now operating and now available in Alabama. So what we have is a mobile nurse team who will come out and actually treat you at home, on site in your home. And we are using a treatment modality called neurofunctional pain management. I know most of you have never heard of that, and I'll explain that in just a moment what that is and what it entails. But it is a non-pharmaceutical, non-surgical, non-invasive, and non-chiropractic pain treatment program that is delivered to your home. Also, this is covered by Medicare and commercial insurances, and which is probably what you noticed in the title and in the description of the video. So let's go into that. Let's talk about what this is. Electroanalgesic therapy is neurofunctional pain therapy is composed of electroanalgesic therapy, IV nutritional hydration, and health coaching. And these three components actually work really well together to create a pain relief outcome. So let's talk a moment about electroanalgesic therapy. This is a high pulse electrical current, electrical stimulation, that's been in the market for a long time. It's actually been FDA cleared for pain treatment for probably 35, almost 40 years now. And I know what you're thinking. It's been in the market so long. Why haven't I heard of it? And I like to joke around. I'm literally seeing people make the skeptical face like, well, I haven't heard of this before. And doctors as well. Hey, if this is so great, why haven't I heard of this before? And I'm in the field. I'm in this arena. I know what this is, and I've never heard of this. So there's lots of great reasons why they've never heard of it, why you've never heard of it, why your doctor's never used it or heard of it. It's been around for a while, though. It's been in for 35 years, and there's been hundreds of doctors around the country that have actively used this kind of therapy before. But there's very good reasons why you just don't see it, and I'll explain those here in a moment. But electroanalgesic therapy, what is it exactly? It is a high pulse current that's a lot of people think of like, oh, a TENS unit, like you put the pads on and it stimulates your muscles. So a TENS unit is a muscle stimulator. This is electroanalgesic therapy is a neural stimulator. It actually will stimulate pain neurons. What it's doing is it's depolarizing pain neurons and actually producing this pain relief effect. It's inhibiting the pain signal to the brain. Depolarizing the neuron is what's causing that, the pain signal inhibition. And then it will de-escalate that pain and inflammation cycle. So most of you have probably heard this before. Pain will trigger inflammation, and inflammation will trigger more pain, and you've got this cycle. Most of your pain management efforts out there are some attempt to reduce or de-escalate that cycle, that pain and inflammation cycle. And all sorts of medications, drugs are, discovered and designed to try and interfere with that inflammation and pain cycle. So that being said, that's what's actually causing a lot of these chronic pain issues that people experience. So when you depolarize pain neurons, you actually produce an ongoing pain relief effect afterwards. So a single treatment event can often last for several days. So when people ask, well, okay, so do I just have to do this all the time forever? Not necessarily. What happens is that there's a cumulative effect that occurs. You have a single treatment might last for a few days, but if you do this on a regular basis for weeks, you end up with a very long duration of outcome. Our program is a 1 hour treatment twice a week for 8 weeks. And that's what we're looking at here. And that will produce an ongoing pain relief outcome for most patients. So how long is the question I get asked all the time? Typically, whatever success you have upon completing the program, we expect that to endure for somewhere between 3 to 6 months. That's the norm. That is the expectation. 3 to 6 months of ongoing pain relief. And we've seen that with hundreds and hundreds of patients. We have treated thousands, maybe tens of thousands of patients around the country with this program. I created it back in 2018, and I put this program in doctors' offices, and I noticed very quickly that despite it working for patients, the hard part was that the patients who were actually in pain had a hard time just getting to the office. It became very difficult to actually have the program going because patients didn't want to have to travel, go from the house to the office and do that, like I just mentioned, twice a week for 8 weeks to actually have a long-term outcome. That's very difficult. And some patients don't even have rides and can't get in. So there's just having it in the office was not working as well as I had always wanted it to. The mobile program solves all those problems. It's actually a nurse who will come out and treat you on site in your home. And that's wonderful because it relieves the issues of a patient trying to get in and out, and it makes it possible for you to actually get treatment. Now, I'm going to go into the rest of the electroanalgesic therapy. We're going to talk about the efficacy of the program, and then again why you don't see it currently in very many places. But so electroanalgesic therapy is the first of those therapies. The second one, IV nutritional hydration. So it's a vitamin mineral mix and a hydration IV. The issue that we have noticed over the years, and a lot of people, a lot of doctors and providers, medical people will agree with this, is that chronic pain patients typically are also chronically dehydrated, and also have chronic nutritional deficiencies of some sort, some lack of vitamin minerals that they should be getting. There's just a lot going on. That IV does add a lot to the program. So the electrical therapy works wonderfully well. When you combine it with the IV, you have an actual synergy effect on health outcomes, and that pain relief aspect is just works better. So what we've noticed is that patients will typically get better faster. So they would have a faster onset. They have a better onset, like a more improved pain relief. It'll typically even last longer. So that's what we've noticed over the years from treating all these patients. So that's the second component. The third component is health coaching. And I know everyone's thinking, okay, health coaching, and that's just telling me to be better, eat better, go out and get more exercise. Well, yes, kind of. There's a lot more to it than that. What we've noticed over the years too is that patients who have chronic pain oftentimes have very little motivation to do other things, like go out and be healthy, right? Well, I'm in chronic pain. I don't really feel like being healthy right now, and that's kind of literally the comments and attitudes that I've seen from people who have chronic pain. There's a lot of research showing if you eat clean and eat healthy and things, you can get rid of pain that way. Like you can, and I've seen it happen for patients who just overhauled their diet and lifestyle, and the pain naturally would go away. That's great. That doesn't necessarily work for everyone, but also too, patients are saying, I'm in pain right now though. Like I don't want to, sure, I can start doing something that will take months and months, but what do I do in the meantime while I wait months and months for this to work? So having a pain option to treat them now is great, but the health coaching will help motivate and produce an ongoing and a longer outcome. So I've noticed this too, that when patients start getting out of pain, they start having motivation to do everything else. They want to start eating better. They want to start getting exercise. They're motivated, right? There's a light at the end of the pain tunnel, right? They can see it, and they get pretty excited. So I've seen just so many patients who are just very excited to actually get healthier now that they're out of pain. And so that's one of the reasons why we added health coaching in over the years, is because we just know that as soon as you start getting out of pain, we are already talking to you about all these health modifications you can make and all these things you can do to help improve your health. And again, ideally, help that outcome last longer and longer, as long as possible. So that is the overall program. Those are the three components of the program. All three of those are occurring on site in your home. And the efficacy rate, people like, how effective is it? Does it work? Across the board, 85% success rate. That is what the doctors have estimated from all the doctors we've worked with doing this program over the years. We asked them, doctor, what do you think is the average success rate that you see from patients coming in here? And keep in mind, we're talking about a couple dozen different types of pain conditions here, not just neuropathy. And the doctors would typically say it's about 85%. 85% of patients are achieving a greater than 50% reduction in pain, which is what they consider to be successful. So, greater than 50%, meaning 50% or all the way to zero, right? So everybody in that category. And that's the majority of patients coming through the program. So they say that. And then, of course, I say, well, is there any one particular condition that you see that's even better than that has better outcomes? Neuropathy, fibromyalgia, there's a couple others that they will mention as being, I see those having even more people are having success with that one than the other ones. So let's just say 90 to 95% success rate with some of these other ones, according to what the doctors are telling us just from their experience. And I've talked to them and I said, I know it's hard to say that something would be that effective because everyone's, afraid to say, oh, it works for everyone. Well, it doesn't work for everyone, but to say that something is close to 90% effective at achieving a substantial reduction in pain, it's still a bold statement, but at the same time, when they would sit there and think about it, they're like, yeah, actually, they were thinking of most patients getting significantly out of pain and thinking back on all the medical notes that they have and thinking, I have very few patients who actually who don't succeed. There's hardly any actually, really 1 or 2 out of 10 at best are not having the successful outcomes that they want, and everybody else is. So the majority of people go through the program are going to have these pain relief and successful outcomes, which is very exciting. So that being said, why don't you see it already in doctors' offices? Get that question all the time. And so the short answer is it's not convenient, efficient, or capable of being, really managed in a doctor's office. Think about this for a second. The treatment is an hour long, twice a week. So right there, you've got a patient that's sitting in the office for an hour, 2 times a week. And now multiply that times how many patients does the doctor have? And you can see pretty quickly it doesn't work. A doctor might be managing hundreds and hundreds of patients. It just doesn't work, right? So there's a few offices around the country, a few doctors around the country where they have modified their practice to accommodate this exact treatment model, where they would have the patient come in twice a week for an hour and do this, right? Most doctors just aren't going to be able to do it, right? Pain management doctors don't have time for this. They've got hundreds, maybe thousands of patients they manage. Primary care, same issue. They just don't have time. They don't have time, space, equipment, staff. They don't have all that stuff to do a major program in the office. That's why the mobile program is so perfect, because now we can actually treat you at home. You don't have to go to the office, and a nurse will come out and treat you there, it solves all those problems, right? So I also point out too that with peripheral neuropathy pain, you've got quite a number of symptoms that people have to deal with. And again, that also makes it very difficult to actually travel in and out. And that's why the mobile program is so effective. So now you've heard kind of what this is and how it works. Most people would say at this point, okay, so now what? So we would love for you to come to the website, take a look at our site, our pages. We have tons of information about the actual treatment, how it works, all the different conditions that we can treat for this. Your nurse that lives closest to you will probably have a profile on our site. You can actually take a look and see who's near you, and actually fill out a quick insurance form. We are covered by Medicare and commercial insurances. This program is. And so all we need to do is just, we get your insurance information so we can actually do a quick check and see which of our providers we work with can actually work with you and order the program for you. Once they see you, they do a visit with you, they'll actually then order the program, and the nurse will now carry out the treatment for you in your own home. So we are excited to work with you. We're excited to see you in our system. I would love for you to reach out to us on the website and say hi, and we look forward to working with you, and we hope this works for you. Thanks so much.